Welcome to Adapt and Class. This is the home of content simplicity. Are you struggling to answer questions on pediatric nursing? In this short video, I call it the ultimate crash course. In a very short time, I'm going to give you the most important things you need to know to answer all the testable questions you will see on the NCLEX or nursing school. We're going to talk about growth and development, all the pediatric conditions that you need to know, the safety issue, in a very short time. And by the end of this video, you'll be ready to answer any question. So grab your pen and paper, click the like button, write down, I'm ready, and put a comment down, and let's go and master this. First thing we're going to do is growth and development. It's a raw information, but I got you. I'll make it memorable as much as I can. We'll start with what? Kid, infant. Infant classify 0 to 12 months. Sometimes people divide them into 0 to 6 and 6 to 12. It's okay. The most important thing I want you to learn about these people is what? This is what the NCLEX is going to ask you. Birth weight. Very important. If you don't know anything, 6 months. It's going to double. 12 months. It will triple. Done. That means their weight will triple by 12 months. And then it will double by 6 months. That's all. Next thing you're supposed to know. Fontanel. What is going to happen to them and what is their shape? Fontanels. Very important. Very important information. We have two types. We have anterior one. Where it's located is the front one. What is the size? Is the bigger one is a diamond shape and it's the biggest. When would you close? Because it's bigger, it takes a long time to close. When? 12 to 18 months. Therefore, if you see a kid who is 2 years old and still has a fontanel anterior open, we have a problem. But if they give you a question, patient 6 months old, and the anterior fontanel is open, expected finding. That's what they trap you in expected finding. So write it down. Anterior fontanel closes at 12 to 18 months. Of course, we're going to have a posterior fontanel. It's on the back side. It's the smallest one. It has a triangular shape. Small one. And it's triangular. And it closed early. So when does it close? By 3 months, it should be gone. If you stay there, we have a problem. These two things, I want you to know them. Now, the milestones, you already know. Let me show you easy way. Kid cannot move without moving their whole body. So, gross model. Gross model, you don't need to know 1 month, 2 months, 3 months. Pick the biggest one, the landmark, the middle ones. So, how would the kid start moving? Is to roll over. And he will do that 4 to 6 months. If he's able to roll, he can sit. They will get up by 8 months. They will sit unsupported. 6 months, they can sit supported, right? But these ones sit unsupported by 8 months. And since they can do that at that time, by 12 months, they should be walking with some help. That's all. If you have a gross model, now you start to use your fingers now. You don't use your body. You're going to use your fingers. This is what we call fine models. Fine model scale, right? And why are we doing fine model? Because we want to eat with a spoon. So everything goes through the pencil, right? So you should be able to grab something like a cube on the floor. So they start to grasp things on the floor, object, by like 5 months. In 6 months, they start to develop it. They can pick something on the floor when it falls down. And by the time they get to what? 10 to 12 months, by 9 months, it will start developing. By 10 months, it should be perfect. This is the pencil grabs. There's two types. There's the gross and the fine. The fine one has to be there by 10 to 12 months. Well, they should be able to be talking now. That's when the language comes in. We want to know what the kid is doing. language. And the language starts with the basics, always 2 months. And what do? They're cool. After that, 6 months, they're going to babble. And then 12 months, they'll have some words. 1 to 3 words is okay. What else do you need to know? This is important. I want you to write it down. This is Erikson. How is the kid interacting with the society? When they come in, they have to trust their mother versus mistrust. If they don't trust the mother, we're going to have a problem. That's why when the baby comes out, the first person they look is the mommy's eyes. Trust. That's the key. So no, trust and mistrust. So everything is based on that. Now, safety, before that, let me talk about play. They're going to play because the NCLEX love it. What kind of play are they going to have? A 6 months old. He has no friends. He doesn't care about anybody. Who does he care about? Mommy. So they're going to have solitary play. Just me and mommy. Nobody disturb me. They don't want to get involved. If you want to give them toy, what do you think? This is concept, common sense, memorization, adapt, and clear way to figure it out, right? You're trying to deduct. Don't memorize it. Toy. They have no relationship. They can't move around too much. What would they do? They will find toys that will talk to them, mostly sensory. So pick an answer choice that is providing some sensory information, sensory stimulation to the kids. So what do you think? Soft rattles, things that rattle, that's what they like. You make music, right? Back and forth, right? Crickle toys, those are the things they want. They don't want to push things around. This is usually 0 to 6 months. By 6 to 12 months, yeah, you can give them like push-pull, right? Push-pull toy, right? That's when they're a little bit older, 6 to 12 months. But the most important thing to remember when you're picking an answer for a toy, think about it. Is it sensory and is it stimulating? And then when they get older, between 6 to 12 months, these are all infant. Can they sit and crawl? Because they're crawling. They're moving from back and forth. By 8 months, they're sitting unsupported. So 6 to 12 months, you should give them something that will let them move a little bit, right? Softball. That's all. And the last one, what do you think I'm going to talk about? Safety. Safety. Red. Safety, safety, safety. And kids love this. Safety, because the safety exams. And what are they going to ask you? Car seat. What about car seat? It's going to be rear facing till when? Until 2 years. This is the standard, right? Some books will tell you about age and height and everything. This is a crash course. I want you to, if you don't know anything, I'm not going through all the esoteric information. I'm giving you something, make you comfortable to answer questions. And I said, listen, 2 years is the basics of safety when it comes to kids' safety, 0 to 12 months old. So what do? Rear facing until they are 2 years, and then they can come out from the rear facing. And what are we worried about them? The most important, the weight difference, it doesn't matter. You don't need to worry about it. I want you to worry about their gross motor. They too, they're developing still. So gross motor is very important. Since the 1 year is already getting up and walking, these people should be walk alone by 15 months. Since you're working with help at 12 months, 15 months you should be. And then 2 years, you should run, right? And 2 years, you should be able to climb stairs. This is very important because then when they get to a preschooler, they have to ride a bike. So it's very important. They are fine motor. They already have a pencil. So they should be able to do more than that, right? Fine motor, I can pick a block, 2 to 4 blocks and build it, right? I can build it. And now I can hold a pencil and I'll feed myself. You see how it makes sense? They can start feeding themselves. Their language should be more than what the infant have. right? So they will have more words. So the language, which is the social, they can have 2 to 3 word phrase. So watch for answer choice. Word phrase is different. That means you put in sentence together, right? By that, they don't communicate that way. A phrase is not that complete a sentence, right? So watch for the answer, 2 to 3 word phrase, but their actual vocabulary should be close to 300 by 3 years. Now, let's go to Erikson. If you don't trust anybody, what do you think is going to happen to you? You doubt, you have shame. But if you trust, you start to take autonomy. Oh, mommy trusts me. I can do everything I want. So trust and mistrust followed by autonomy and shame. And the kid will have a shame in class. He doesn't want to talk. What is your safety problem? They're moving now. Anything they pick, you put it in their mouth. Therefore, poison. Okay, that's the key. Poisoning is the key. Hide them. They're going to drown. They're going to the water because now they're moving. Nobody's there. That's a problem. They put things in their mouth, choking. When you see a question, think about it. You said, oh, what am I going to worry about in the kid who is the toddler? Just go with this. What? Poison, choking, and drowning. That means I'm putting things in my mouth and they're moving more often. So these are little things I want you to pay. You don't have to memorize when you ask a question. Find the concept and then use it to answer the question. They're going to ask you about their play. These people, they said, well, come on, come to me, but I'm not going to play with you. So it's a parallel play. So you can come together and play along that, like a 2 streets parallel to each other, they don't cross. You can play with your football and I can play with my basketball, but we're not going to share anything. They are parallel play. That is very, very important. And then if they ask you questions about toy, think about it. These people, what is the thing? They're already walking, they're moving. Give them something that will keep them walking. Focus on walking. That's the toy you give them. I mean, I don't want you to pick a kid that anything that a younger kid will use it. These people ride. They like to ride on toys, right? Because they're moving. They love to move, right? They will try to play some board, but most of the time I want you to focus about movement, right? They can also do push and pull. You let them move. They're already building blocks, so they can do that. They are fine motor. They can do other things, but most important is moving. What do you think? These are pediatric things that you got to make it fun before you can understand them. Otherwise, they're boring. Now, a preschooler is my favorite because they are magical thinkers. They are magical thinkers. The milestone they're going to achieve, I call them the terrible threes, right? So basically, tricycle. They have to ride their tricycle by 3 years. All right. They got to use their scissors by 4 years. And then they got to draw a stick fingers, right? That's 6 body part by 5 years, like a body part, 5 body part individual. That's a great if they can do that. Their language, more words, about 3,000, 2,000 words. The language is more developed. They may get about 1,500 to 2,000 words. I think it's in fine. You can also go up 3,000 by when? By 5 years old. Erikson is very important in this stage. First, you have trust and mistrust. If you don't have the trust and you have mistrust, what are you going to have? In the next stage, you end up being shameful because you've not achieved autonomy. If you achieve autonomy, what are you going to do? You start to take initiative. So these people have initiative versus other kids who are guilty about anything in class. That's the problem. So these are the stage. The parallel play are the toddlers, right? They play along each other, but they don't share. These people, they involve in associative play. That means we can play together, but you are not my boss. So there is no boss. There's no boss in charge of me. I'm doing my own thing. I can share my things with you, but you are not my boss. They ought to do some play called magical thinking. Like they play things that they see, right? Cinderella and all those things, magical. Those are the things they do. They just dress like they are favorite actors. Yeah, that's the key aspect of these people that I want you to pay attention. That's what they will ask you. And then, what do you think? If you have to give them a toy, these guys that they're older, right? They have more language problem. They have more, they're moving, right? Give them a tricycle, they will ride it, right? Let them build things, Lego. They're more developed, right? They can do some board game. But what is the purpose? It's creativity. Focus on creativity for these people. These are concepts. I want you to focus on that. And cooperation, because they're working together. So pick an answer choice that involve what? Cooperative. And then they want to improve their motor skills. So give them some things that can do that. Now they are in school, which is 6 to 12 years. What do you think they will do? Mostly, we don't care about motor skills, fine and gross motor skills. I don't want you to worry about it. I want you to worry about Erikson. That's the stage that they can ask you questions about. And what is that? These people, since the preschooler is taking initiative, these people will become more industrial versus the other person who is guilty all the time. They will have inferiority. So you can make sense out of it, right? That's the problem with them. What kind of play they're going to have? They're more like cooperative play. That's what they're involved with. They're cooperating with each other. What does that mean? There's a leader in charge of the play. So there's a boss who can assign duty, who can tell you to get out of the game, is in charge. So this is very, very important. I want you to pay attention to, because that's the difference between associative play and the corporate play, because we have a boss who can tell us what to do. Okay, key aspect of it. And there's a competition here. Because of that, there's competition, and there's what? There's rules. If you break the rules, you're going to get kicked out. Safety. What do you think? They already know how to ride a bicycle, therefore they got to wear a helmet. They have to wear seat belt. They're growing. They're out of the booster, right? And then stranger, they start to teach them about stranger danger. Very, very important in this age group. And finally, we have adolescents. That one is easy. You can figure out what is their problem. They are 12 to 18 months old, right? If I have industrials, then I know who I am. I have identity. I don't have identity crisis. I don't wear any clothes I want. So this is the age group. They've identified who they are, the way they comb their hair, the dress they will wear. Versus role confusion, right? That's the problem. And then you have to know their thinking is different. I want you to know that the thinking here, I put Piaget here too, because it's very important. These people will do abstract thinking. It's like an adult. They know when you make a proverb, you don't mean what literary meanings means literary meanings. It doesn't mean the true meaning in the proverb. So they can do abstract thinking. Unlike the younger guys, they can't do abstract. They do concrete, like the preschooler. They do like not like the school age group. They do like concrete thinking. These people will do abstract thinking. You can use it to answer questions when you see it. Very, very important. Safety issue is what? What do you think? They take high risk behavior. This is where drugs and other things. You have to be thinking are that way. High risk behavior. So when you see a question, you got to teach them about things to protect themselves. Drug, sex, and driving, right? Those are the things that you have to teach these kids. Very, very important. And this is the crash course on pediatric milestones. And if you know what I've said in the few minutes, you golden. You're most likely going to answer a bunch of questions, but this is content related to that. Now we're going to move on to pediatric pharmacology. Are you ready? Type "I'm ready" in the comment section and give me a thumbs up. For the pharmacology, you don't have to worry about anything. Principles. Adapting class is the home of content simplicity. You want to make the content what? Simple as much as possible. Therefore, principle. We're going to base on principle, right? If they give you a dosage calculation, I want you to always check the weight. You don't just give it to the kid and it's go by milligram per kilo. Everything go by that. NCLEX favorite question: avoid aspirin or salicylate product in this case. That's all. Why? We have Reye syndrome. Are they going to ask you this question? No. Straight like that? No. They will tell you patient has a flu, he has a flu, and then the mommy is trying to give them a salicylate, Pepto-Bismol or something like that, that contain aspirin. And what are you going to do? Intervene. That's the way they're going to ask you. They're going to get immunization. In case, where do you put it? IM injection. Where? Which portion of the body do you apply it? What do you think? I can tell you it's vastus. What is that? Lateralis. This is to avoid all the nerve and other things for infants. If you have to give an IV site in a young kid, what would you do? IV. These are key questions, little things, fundamentals. If you know it, you can answer it. IV site. Where would you put it? You put it in the scalp vein in an infant. It's prominent, it's bigger. If it's a children, usually you put it on the hand or for forearm. Fundamentals questions, don't mix it. So this is kids, right? You put it in the arm or forearm, the hand or forearm. Okay, these are common sites. What are the common medications they may ask you? Well, know something about them. Acetaminophen, common medication, and usually we give it like 10 to 15 milligram per kilo, right? That's the common dosage per kilo that they may ask you. And you give it every 4 to 6 hours. Common one. Ibuprofen, if you see it, if you see ibuprofen, remember, you have to be more than 6 months before you can get it. Never give it to anybody who is less than 6 months. There's going to be congenital heart questions on kids, digoxin. They're going to be on digoxin. You have to know when to hold it. And for children, usually what, 70, right? And then for infants, usually 90. So hold it if less than 90 in infants, and for a child, 70. That's the apical heart rate. So these are very, very common. They're going to have antibiotics. What are you going to monitor for? Allergies and rash. Common NCLEX questions like these little things, you got to put it at the back. They're going to complain about what? Diarrhea, you got to monitor it. You're going to complain about rash. These are major side effects. Welcome to Adapters NCLEX Crash Course. Like I said, straightforward information that they will ask you on your NCLEX. Now, we're going to focus on common pediatric disorders, and I want you to take a pen and paper. These are concepts that shows up. Write them down, and then read about it more. But these, if you don't know anything at all, I'm giving you the little things as much as possible at the key high yield, high point that after you study, that's what you should come up with on your own. And so that's what we're talking about. So we're going to talk about disorders. There's going to be a bunch of disorders. Let's start with the respiratory because it's high yield. A lot of kids always have respiratory problem. Which one are they going to ask you? Number one, RSV, bronchiolitis, right? Respiratory sensation virus. This is big. Don't take the NCLEX without not knowing anything about this. You can get a case study from it. So be careful. And the disease cause is what? Bronchiolitis. It's like cystic fibrosis in a young kid. Pay attention. What is the cause? This is a viral. Therefore, it does not need antibiotic, right? Key, it does not need antibiotic. So you should not give them aspirin too. They get Reye syndrome. That's all. We have viral infection, which causes inflammation of what? The bronchioles. That's the little tube before you get to the, after the bronchial branches. And you have mucus buildup. And then what happens? They get infection common in your kid less than 2 years old, or those who are immunocompromised, right? Less than 2 years old, or they have lung issue, very, very common. And this happens in the winter, as we are in the winter right now. They're going to have symptoms, common symptoms. It's like common cold. They're going to have what? Runny nose. It's like a pipe, right? Water flushing, like water running. That's the way to remember them. Like it's running like water. Their nose is running like a water, right? Runny nose. That's number one. Of course, they're going to have wheezing. They're going to cough. These are all normal. What is your priority? If I see what? Nasal flaring, I'm worried about it. I see intercostal retraction. These are buzzwords. When you see it, you say, something is happening. These are irritability, bad, right? So this is what is going to happen. Most of these kids can be managed at home. What do they need? Fluid, and suction their nose. Do you have to put the suction all the way deep in their nose? No, just at the nose, right? And suction it, right? You suction them before feeding also, so that they don't vomit. And then provide oxygen, humidify oxygen. Key concept as much as possible. And these kids will be fine. Their symptoms look horrible, but all you need to do is to just provide some safety for them. Otherwise, they get into trouble. Where do you think they will take you? If they give you a case study, where? This is crossover to infectious control. So know this. Infectious control, let's get to it. RSV, common infectious control question that shows up. Why? He has contact droplet precaution. You see, one, he has two of them. Therefore, you got to deal with two. Therefore, what do you need? Contact, you need gloves. Now, droplet, you need a surgical mask. You see, that's all. You don't need too much, right? That's the key. Hydration is the key. You don't need antibiotic. I said it. Very, very important. If you see this in your test, they're trying the question, but if sometimes it's true because this is a hard one. But if you know it is good because you don't know which one they're trying. There is some medication we can give this pharmacology for pediatric RSV infection to decrease the duration of the infection. It doesn't prevent it, but we give it to high-risk patients who have lung problem to help them. What do you think? Write this down. Know it. Palivizumab. This is the medication that you will see. It's immunomodulator, and we use it to prevent severe infection in patients who have high risk. This is RSV in less than a minute or two. Know everything I've said. Write it down. Watch this portion carefully. If they give you a case study, this is all you need on that screen. Once again, if you see a case study, this is all you need on that screen. Or if you see a question alone, this is all you need, because it's a potential case study question you may see. Next problem is Croup, my favorite, because he has long problem, long name. He has laryngeal, I don't like typing it, right, to the larynx, and then to your trachea, and it's you go down all the way to your bronchiolitis. So he has a long name, but it does not matter, right? It does not matter. Just call it Croup. That's all. That's the way you can call it. Croup is the easy way you can call it. What is the problem? That means you go deep down into the airway. So if this is your trachea coming down into the bronchiole, so there's inflammation all the way down here like that, from the larynx down. So you can cause stridor. It's a bad problem. What is caused by is also a viral problem, parainfluenza. You've seen this before in what? Infectious control. And so you got to know how to treat these patients, right? What are the common signs and symptoms? Croup, all the time backing and backing cough. That's their problem. Why do they do that? Because of the inflammation, in order to clear the obstruction. They're going to have what? Inspiratory stridor. Very, very important. Inspiratory stridor. That's the key. And they're going to have hoarseness. Some of these are expected finding unless the kid is having some severe problem and low fever. This is classic for what? Croup. What do you think you're going to do? Nothing. Cold mist, humidifier, right? And then some oxygen. After that, we got to open the airway, racemic epi. This will take away the inflammation and prevent the stridor. They may need some steroid, but these are the common things we give it to them. What do you think we should do? Is infectious control. Very, very important. And you have to continue to monitor them, right? This is what? Droplet precaution. So institute your droplet precaution. Don't forget all the infectious control. They may ask you that. Very, very important. Now, the third guy is what? Everybody know it. Epiglottitis. These are all conditions, respiratory conditions that I think you have to know whether you like it or not. This is caused by H flu, Haemophilus influenza, right? Haemophilus influenza. Very, very important. They have the 4 Ds, right? This will happen suddenly, right? Onset. The kid will be drooling. They will have dysphagia, right? And then they have dysphonia, and then distressed airway. This is why I call it 4 Ds. Drooling, dysphagia, dysphonia, distressed airway. The airway is distressed. That means they die. They are looking for air. They will be drooling. They can't swallow their saliva. When they swallow, it hurts. Dysphagia. And when they make a sound, they have dysphonia. It doesn't sound right. And they will have what? Fever. And when you look at a kid, it will be in the tripod position. Epiglottitis. That's all. What are you going to do? What are you going to do? Do nothing. Don't look into their mouth. Don't pick their answer choice. Never look into their mouth. Don't insert anything in their mouth. Don't do that. All you do is prepare for intubation in case it happens. Otherwise, supportive care. So supportive care. Crash course, pediatric respiratory, in the very straightforward. What do this kid need? IV antibiotic. There's a therapeutic communication question. Don't mix it. Your mommy will ask you, what happened? You know, can be prevented by vaccination, right? And this is the hip vaccine. You can say, why don't you vaccinate your kid? Just be therapeutic in your answer choice when you're picking it. This is all. Never put anything in their mouth. You don't need to suction them because then you're going to cause problem. Why we don't give them racemic epic? We don't give them epinephrine, racemic epinephrine, because it can make them tachycardic. If it causes tachycardia, they become more anxious and they have distressed airway. Anxiety is not good for a distressed airway. How are you doing so far? This is your crash course. We're talking about pediatric disorders. I'm making it straightforward for you. I said, know this information is enough. You can go and watch more videos, but try what I've told you. If you don't know at all, I will know these things. The next one is cystic fibrosis. He has what? GI and a respiratory issue. He has GI and respiratory issue. This is a genetic problem caused by autosomal recessive. That means you get one from your mother and one from your daddy. How? What is the function of the gene? Is control sodium chloride channel. In the process, regulate salt and water. And since there's no water and you're losing salt in fluid secretions, they get thicker. And which organs make a bunch of fluid is the lung and the pancreas. So these are the two organs that are really affected. And therefore, we have a problem. When it comes to the lung, it's like acronym you can use. Or if you don't, the name is come from the name. That's the way I think about it. How? I call them the bunch of C's, right? They have the chronic cough and the clubbing. That's the key aspect of these diseases. And they have recurrent pneumonia, lung infection. That's the key things that you have to know. So they have recurrent lung infection, hypoxia, so clubbing of the feet, and they have chronic cough. If you come to the lung and GI portion, they cannot absorb fat because the pancreas is responsible for that, right? So they're going to have fatty stool. Common thing. You have failure to thrive. They cannot absorb anything. They will be skinny. They're more nourished. What are you going to do? Nursing care. They're going to ask you. Number one, airway. What is that? Chest physiotherapy. I'm just giving you stuff that it should click in your ear. Oh, I know chest physiotherapy. Why? We call it postural drainage. Postural drainage. Well, their head is down, the face is on the ground, and you panning on their back to break down the secretion. When you do it, you do this before meal, right? If they already eat, then you wait 1 to 2 hours. This I've told you. If you get a question, that's what they're going to ask you. Straightforward. What else? You have to let them drink a lot of water to break down secretion. You have to give them bronchodilated. You got to give them things to break down secretion. Acetylcysteine, called Mucomyst, right? Acetylcysteine. This is Mucomyst. This break down the secretion and make it easy to pass. When you come to the GI, they need the enzyme, so pancreolipase. They can't eat without it. They have to eat it with snack and food, with meal. Very, very important. What kind of nutrition do you give it to them? High protein diet, high fat diet, and what? High calorie diet. Why don't you give them high glucose diet? Because the pancreas is not working. If the pancreas is not working, they're more likely to get diabetes. And therefore, we have a problem. Last one, you need to replace their vitamin. What kind of vitamins are they lacking? A, D, E, K. So give it to them as much as possible. You see, you master what? Respiratory and what? GI issue regarding cystic fibrosis. Know it. These are concepts I want you to memorize, but not memorize completely. Understand it in this crash form way. Whether you like it or not, you're going to get a cardiac question if it's a pediatric. They're going to ask you two information. CHF, okay? There's kids who get CHF, whether you like it or not. They present like what? Different way, like an adult. So CHF in kids, they usually poor feeding. That's classic, right? They may have failure to thrive. That's FFT, failure to thrive, right? They may have other classic signs, tachycardia, right? Tachypnea, edema, right? Big spleen, big liver, right? You know, the left and right heart failure, they may have the same thing. What is the problem? You treat them like any adult, right? So nursing care, right? You weigh them, check their weight, then you give them their digoxin, same way, right? And then you have to monitor when you hold it and when you to give them. And how do you give them? Day to day, going to have furosemide. Watch their what? Potassium. Very, very important. And we talk about it. If the heart rate is less than 70 for kid, you hold it. Less than 90 for infant, you hold it. The heart portion is this, congenital heart defect. You're going to have left to right shunt, left to right, and then right to left. Left to right and right to left. What is the difference? Left to right means the blood has gone already to the lung. So it has what? Oxygen in it. So left to right has oxygen in it. So the baby is not blue, right? Not cyanotic. And what is going to happen? Mostly the blood is keep on going to the lungs. So they have CHF and they have pulmonary issue, lung problem, right? That is the lung problem. Therefore, what is going to happen? They're going to get tired. They're going to have poor weight gain. And they're going to have heart failure symptoms. That is the key. When you're feeding them, I want you to know this. When you feeding them, they're going to be what? Diaphoretic. Diaphoretic, right? That is the difference between them and when they have right to left shunt. They're not going to be blue. What an example of left to right shunt is anything that does not have T in it. What is that? ASD, VSD. That's the most common one. Or PDA, patent ductus arteriosus. If you need more detailed concept, you need it for nursing school, and you want to know more, just check Adapting Class. I have more videos you can watch. Right to left. What? Baby is cyanotic. It's going to turn blue. What are their names? They have what? T's in it. The terrible T's, right? Tetralogy of Foley. That's the most common one. The rest, you don't have to worry about it. If they're going to ask you questions, they're going to ask you tetralogy of Foley. What are the components of tetralogy of Foley? How did it happen? You have to have some idea. What is the problem? Let me draw the heart in a very simple way. This is your heart, and it's divided into 4 chambers. You have the right atrium, right ventricle, left atrium, left ventricle. Blood needs to move from here from the right ventricle to your lung. Your lung, what is the problem? You have stenosis of the pulmonary artery. So there's a blockage here. So blood cannot go there. So what happens? Blood comes back and it make the right side bigger. So right heart hypertrophy, right? And then as the blood stay here, we got to have an opening to send the blood to the left side. And therefore we have a ventricular septal defect, and it get here. When the blood get here, the left ventricle is not working, and so the aorta take over. So we have overriding of the aorta. So you have what? Pulmonary stenosis, right at hypertrophy. We have ventricular septal defect and overriding of the aorta. Those are the components of tetralogy of Foley. And it's good to know about it in case they ask you, what does that mean? That's all. What do you think the NCLEX is going to ask you? This kid, they're young. We teach them when you get sick, knee to chest. Well, that's what the kid is going to do. When you feel like you're getting sick, it will do knee to chest position. If it's a younger one who can do that, you need to swaddle the kid. This is to prevent shunt. So shunting is knee to chest. It's better than giving them oxygen. So the first thing you do is knee to chest before you give them oxygen. If you see a question, that's what you pick. And what is this word called? This is Tet Spells. They will tell you here is a tetralogy of Foley, and it's what? Turning blue. What do you want to do? Knee to chest, position as much as possible to prevent it. And then later on, we can fix it. This is my favorite pediatric condition, Kawasaki disease. What is the problem? This is a vasculitis, inflammation of the big artery, which is your aorta. It's the one that is mostly affected. It's a viral infection. It leads to this severe inflammation. There's key features you have to know. I call it T cream. How? T, your temperature has to be more than 5 days, high fever. If it's not, it cannot be Kawasaki. Conjunctivitis, bilateral, both sides. You're going to have rash from head to toe. This rash is going to have red, erythematous. You're going to have lymph nodes, right? They're going to be bigger, adenopathy, right? These are big nodes on your neck. They're greater than like 1.5 centimeters, right? And then their mouth, they have mucositis. That's their problem. The mouth is all chappy, right? Mucositis. Key. And the S is what? Strawberry tongue. This is how you can remember them. If you know all these 5 T creams, I have a bunch of video on YouTube you can watch, but I have a whole video on pediatric, pediatric condition that it talks about all these things. I compare all of them. But this is my favorite mnemonic T creams. And I like it very much because it give you everything about this kid. But what do? Nursing care. We want to break fever, right? Nursing care. That's prioritization. I want to break fever. If I want to break fever, I should give you something that will break fever. First, hydration. And then we give you some medication. What do we give you? I told you no aspirin, right? Yes. But these guys, we got to give them aspirin. If you don't give them aspirin, they're going to get into trouble. They cannot take ibuprofen will cause too much problem, but aspirin is the best answer. But what you worry about, still worry about Reye syndrome. But what is the problem? We prevent aortic dissection. You prevent them from having heart attack. It's much, much better. So you teach mommy to look for Reye syndrome. So that's why you pick aspirin for this patient. Then we give them immunoglobulin because they're going to have edema, right? All the disease process will cause problem. They're going to lose protein. Immunoglobulin, right? And so this is protein. We give them protein. unfortunately, this makes them immunocompromised. And so they cannot take any live vaccine. So no live vaccine as much as possible. This is very, very key when it comes to Kawasaki disease. So watch for that, watch for that, watch for that. Immunoglobulin, they cannot get what live vaccine. You can still give them aspirin, but somebody need to watch them for Reye disease, Reye syndrome, and then we're trying to prevent aortic dissection. When mommy goes home, I want you to check fever. Check their fever. So far as the kid has fever, we have a problem of a heart problem. We got to check them and monitor them. They're going to get echocardiogram to look for aneurysm and make sure they're drinking. That's all. T-cream, Kawasaki disease. One short video for you in a summary. Right. Now, let's switch gear to the GI problem. There's a bunch of GI problems that they may ask you. But I don't want you to forget this. I'm not going to give you all of them. I'm picking those that I think if you know, that's why it's called crash course. It's very good. Pyloric stenosis. Know this. What is the problem? This is the GI tract, and the pylorus is here. So here, the muscle get bigger. It get thicker, and so there's no fluid. The kid here, he can't come here. You just get blocked here. And so stay in their mouth and then vomit. That's all. And this is the electrolyte question when you see it. That's all you care about. So you have a hypertrophy of what? The pylorus. That's the problem. It's the hypertrophy of the pylorus. And what happened? Obstruction. In the process, projectile vomiting, bad words, and their food will be undigested. And it's going to look what? Non-bilious. That means there's no bile in it. It's not going to be green. So watch for that. And when you examine them, they're going to have olive-shaped mass. It's at the right upper quadrant from the mass, right? The major problem is dehydration. What the NCLEX is going to ask you, let me show you. You vomit on all your acid, so your acid go down. You have what? If your acid go down, you have metabolic alkalosis. So that's what is going to happen to these kids. If you're losing acid, you're losing your H+, right? It goes down. You lose all your sodium, go down. In the process, you get rid of your potassium, go down. And so you have what? Hyponatremic, hypokalemic, metabolic alkalosis because you lose your acid. This is key. The NCLEX is going to ask you, what do you need to do? IV fluid, IV fluid, IV fluid to resuscitate the kid. Then later on, they will need surgery. Pyloric stenosis. His friend is what? Intussusception. This is the bowel. The bowel can telescope on itself. So you form like this shape. Telescope on itself. That's all. Intussusception. And how would the kid present? It will be sudden onset, intermittent. The kid will be crying. You cannot console them, right? Sudden. You can't console them. They will draw their knee to their chest. What? Because there is ischemia. The bowel is dying. If the bowel is dying from the telescoping, you're going to have fluid from a dying bowel. And when it's mixed with blood, it comes out as stool. And this stool is what we call current jelly stool. It means what? Stool that is mucoid, that's mucus plus blood. That's all. That means I know that the tissue is getting into trouble. It's getting ischemic from not twisting, but telescoping. There's no blood flow from the tissue die. It releases old blood, and the mucus comes out. And that is what we call current jelly stool. This is the diagnosis of that. When you examine them, you're going to have what? What do you think? sausage. You're going to see a sausage shaped mass. It's not relevant, but you may see it. If you see it, all you care about is to try to save the kid rather than looking for a sausage and shape mass, right? Very, very important. Now, what are you going to do? The first thing is to prevent what? Ongoing carangelous stool. Therefore, we're going to stop that. We're going to use air enema or what? Barium. Air is better. It's therapeutic and diagnostic. Therapeutic and diagnostic, once again, and this will prevent the obstruction, and then this will help with keeping it open. And we kid will need some fluid, right? You're going to be MPO, right? If you vomit, you need NG tube. That's the GI problem. We're treating them. After decompression with air enema, what are you looking for? Put down in the comments. Let me know. Somebody with intussusception is getting air enema for reduction. What are your nursing care? What should be your priority? Need what? Normal brown stool. If you see carangelous stool, that means it's not working. Therefore, we got to intervene. The next one is Hirschsprung. Hirschsprung is mostly, if this is the GI tract, whatever is happening to pyloric stenosis here is the same from your rectum, the same thing. You have your sphincters get tighter and tighter. There's no nerves. That's the easy way I can explain it. No nerve innervation, and so the lower bowel get bigger and bigger and bigger, and it look like obstruction. So the kid belly is big. They cannot poop, so no meconium, and therefore, what are we going to do? We're going to need colostomy. That's all. So no meconium. That's your key aspect. When the kid is born, he cannot pass meconium in 24 to 48 hours, and therefore, what do they have constipation, chronic constipation, and the stool will be like ribbon-like stool. That's what the way to describe it. And this kid may need surgery. The belly will be distended because they cannot poop, and it will need surgery. Pre-op, you need an NG tube, IV fluid. Then we get a colostomy, and then we monitor them. The number one thing I want you to worry about, if the bowel get dilated for a long time and you don't do anything, they will develop something we call enterocolitis. That is an emergency. What does that mean? Entero, bowel, colitis, infection. Entero, large bowel, colitis. You have what? Fever, diarrhea, explosive stool, and then they may have perforation. You see how you can make content easy? This is the way. Don't forget about celiac disease. It can also occur in kids. It's an autoimmune disease. Usually, you see a kid who is not growing. He's eating everything. It's not growing. And what is going to happen to them? When they eat certain food, they'll have what? Weight loss. They have diarrhea. They have what? Bloating, irritability, malnutrition, and they can't figure out what is going on, right? It's because they're eating raw, right? Barley, wheat, oats, and rye. But we should give them what? CPR, which is what? Corn, potato, and rice. So CPR for life, right? Corn, rice, and potato, instead of giving them broth, which is barley, rye, oats, and wheat. And you teach them to stop it. They don't need any other thing. They need a level of teaching, food diary to prevent that. But this is the way to manage them. If this doesn't help, they may need some steroid. But remember, this usually get resolved if you provide good teaching as much as possible. Once again, CPR for life. That's the teaching you teach them. They don't need steroid initially. So far as you can treat this easily, that's easy. That is the GI portion. Now let's go to renal. There's two conditions they're going to ask you. If you don't know this, I want you to write it down. Take your pen and paper and type something down, or in the comment section, if you don't put the like button on, put it on, or in a comment section, just say, we are in the renal section. I got this. What is the problem? Renal, two things: nephrotic syndrome. You're going to get it, either in prioritization question or not. It comes all the time. What is the problem? The kidney filtration system is now very permeable. Now it's allowing loss of protein. And so they lose a lot of protein. If you lose a lot of protein, you have edema and you retain fluid, right? And so kid has low albumin. They lose a bunch of fluid, massive protein. When you do a UA, proteinuria is +3. You're looking 3 or +4. That's your answer choice. That's massive proteinuria. And they have severe edema. They are low protein. So nursing care, these people are risks of infection. So provide neutropenic precaution. That is the key. All the things I'm saying is like me writing questions. That's what I will put. If I'm writing a question, those are the things I will ask you. Don't you think examiners will do the same thing? Because it's the most important. They need a daily weight because they are fluid overloaded. It's autoimmune. They need some steroid, right? That is the corticosteroid. You see, you can make things out of it. They have so much fluid, low sodium, right? Low sodium diet as much as possible. Very, very key. And what? Prevent infection, like I said. You're going to monitor their urine output. And what is your priority? Headache. When you start having headache, that's your priority. Otherwise, don't worry about edema or anything like that. Headache is your priority. His other friend is not nephrotic, but phreatis. So I can say acute glomerulonephritis, right? So this is the nephritis. That means actual inflammation of the kidney, right? And this happening after post-strep. So somebody have strep infection and then they develop this 1 to 3 weeks later, right? So it's autoimmune. This is an autoimmune disease. That's bad, 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 bad. And there's a classic features you should look for. The urine is like red, right? Tea colored, cola, 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 cola. So they will have cola colored urine. It's very dark because of a bunch of blood in it. And they will have edema, they have hypertension, and they have low urine output. That's bad. That's renal failure. These people, same thing. Monitor for what? Blood pressure, and that's your priority. When you go up too much, we have encephalopathy. You got to limit fluid because the kidney is not working. Limit fluid. If you give them too much fluid, it's a problem. This is one of the common mistakes you can make. The kidney is not working. Don't give them too much fluid. And sodium, you got to limit it. Very, very important. And let the kid rest until the inflammation has gone up and they will need antibiotic. This is the difference between nephrotic syndrome and nephrotic syndrome. The next thing about this, you can have UTI, common in kids, right? And usually this is called by E. coli. It's the most common one. They may have the same signs and symptoms like fever, irritability, poor feeding. It's always poor feeding is tell you something is wrong with the kid. They have classic symptoms like dysuria, frequency, abdominal pain. It's fine. Treatment, give them some fluid as much as possible. You know the teaching, right? UTI, fluid, and you wipe from what? From front to back, not from back to front, so that we don't get infection again. No bubble bath, right? And then wear cotton underwear. It doesn't cut things too much. And those are the teaching you teach them about UTI. Crash course for pediatric nursing all the little things you know throughout the systems to help you. Hey, neurological problem. We have not left them all. They're always there. Neurological disorders in kids. Which one is the common? Meningitis. And this can be caused by viral, bacteria, or other organisms. But this is the most common ones that you can see. You know all the signs and symptoms. For kids, it's very important. Remember, high-pitched cry. They're different. Very, very different. In young infant, they may have natural rigidity. Yeah, that one, everybody got it. They may have photophobia. And then they may have Brudzinski and Kernin sign. Brudzinski, right, is mostly irritation of the neck, right, in the meninges. So they have Brudzinski signs. You have to be comfortable with them, how to distinguish between the two. But they all indicate inflammation of what? The meninges as much as possible. But for the most important thing for these kids is the fontanel we talk about. That's your key, and that's what they will focus on, especially if they give you an infant. Is be bulging as much as possible. Hey, meningitis, what do? Antibiotic? No, that's not the first answer choice. Priority is what? Isolation. Priority, isolation. Once again, priority for infectious problem is isolation. So this patient placing the droplet first, then we can place an IV, and then we can give you antibiotic, and then we can take care of you. But we got to protect the rest, and then seizure precaution. You got to protect the rest of the people from getting sick as much as possible. You got to monitor ICP, intracranial pressure. So you got to know the signs and symptoms to monitor it. You have to pay attention to what are the things you need to do to prevent increasing ICP, right? And what are those? Keep the head in the midline. Head, no, don't raise it too much. Up to 30 degrees is fine. Quiet environment as much as possible. Don't let them cough. Don't let them sneeze. All these signs, very important, right? And the head of the bed, 30 degrees. This is crash course for you. Neuro problem. Another neuro problem is common, that come all the time. Seizures. Kids have seizures all the time. You have to know how to treat them. Which one is the most important if I were you? Febrile is a traffic question. Febrile seizures. The kid has too much fever. They have what? And seizures. That can happen. It can be normal, tonic, clonic. Classic tonic, clonic seizure, grammar seizure, and absence seizure. That's my favorite. These are the things that they may ask you. You have to know things that you need to do pre, during, and after. When somebody having seizures, there's different things you do before. Before, you make sure bed is in the lowest position. The kid, what? Both bed rows are up. They're laying on their left side with a small pillow protecting them. If they have seizures, just put them on their left side. Don't put anything in their mouth. If they're wearing any restrictive clothes, you remove it. These are concepts that they may ask you. After the seizure, then you take care of them, reorient them, clean them up, protect their airway. So it's all depend on what you do. So protection of the airway is very important post-seizure. And then losing their clothes when they're having seizures as much as you can, right? But never put anything. And make sure you time them when they're having seizure. I've given you all the things you need to know during, before, after, because those are very, very important. And don't restrain them. If you restrain them, wrong answer. Don't pick anything that talk about restraint. When it comes to seizure disorder in the kid, that's a bad thing. If you do that, that's not good. If they are having seizures, what medication you give them? Benzos. Once again, benzos, diazepam. Don't give them valproic acid or phenytoin. Don't give them because these are long-acting. So phenytoin or valproic acid or carbamazepine, they are for long-term. We don't use them in acute seizures. You may get a question on hydrocephalus. It's like fontanels, that's all. That means the kid is accumulating fluid. And this will lead to ICP issue. So the question is an ICP question, right? What are you going to do? Their head, or what are you going to see? It's going to see rapid head development, right? Their head is developing so fast. So head growth is like more than the rest of the body. The fontanelle will be what? Bulging. And the sutures will be separated. These are bars where you see in the question. Sutures are separated. They will have something we call sunset eyes, right? So this, you see it in the question, that's what it means. The kid will have high pitch cry and they will have irritability. These are signs of ICP in the kid. Know it. This is a common question. Somebody have had it before. I mean, they told me these are asking questions about ICP issue. These are classic things they may ask you. What is the treatment? It's what? VP shunt. That means take the fluid from their head into the abdomen, right? And then you position them in such a way that is very, very important. After the procedure, position them flat on the non-operative side. So if they operate on the right side, you place them on the left side. And you monitor them for signs of infection and evidence of meningitis because we put something in their head. Musculoskeletal, my favorite too. Because there's a weird conditions they can ask you. DDH, right? This is developmental dysplasia of the hip, right? He has a bunch of names, right? This is fine in kids. So developmental dysplasia of the hip. There's a hip problem in kids. How do you know? It's a selected apply. What do you think? Uneven, what? Brutal fold. When you see it abnormal in kids, newborn, there's a limited abduction. When you try to bring the two legs apart, you can't do that. And when you do that, you're going to hear clicking sound. That is what? Otalano and Balo sign. You don't do that, but the doctor does that, right? Those are the things that we know something is wrong. If you hear that, let the doctor know. The question they're going to ask you next is this. What do you do? Treatment. And what do you do? We're going to try to help them by putting them in harness. What is the name of it? Public. If you want to read more, you can find the book and read it. But this is the harness that we use to help with the kid. We're going to maintain it and we position it so that it's best for the kid. The mommy will ask, what do I do with it? You can still dress the kid. You can diaper them. It's okay. You can provide skin care. Don't just leave it on. So maintain harness position, no lotion or powder under that. They will be attempted to put lotion and it's going to cause irritation. Don't put anything on it. Just keep it in place. And it's designed that a baby can poop. It can do things without any problem. The other condition is, I don't know why they like it too much. It's clubfoot, right? That is Talipes equinodavin, but don't worry about it. Talipes, right? Clubfoot, right? When you see it, next question will be what? What do you do with it? They're going to put a cast on, so serial casting until we can position back to the normal position. And then these has to be changed every 1 to 2 weeks. Very important. We got to change it so we cast it, serial casting, until we can design you very well. The nurse have to provide neurovascular check. Last one is scoliosis. I just pick things that think if you know it, you're good. Clubfoot, know that we do serial casting, we got to do neurovascular check, and 1 to 2 weeks, we got to change it, right? 1 to 2 weeks, we got to change it. This 1 to 2 weeks, we got to change it. So, scoliosis, we find it in young kids. It's just like the curvature is affected. Lateral spine curvature is uneven, right? Uneven of the curvature. What is the treatment? They wear brace. How long did they wear brace? Until the alignment and the prescription. If it doesn't help, they will need spinal fusion. But the nursing care is very important. The brace has to be worn 23 hours a day, so you can only get 1 hour break. You can wear a shirt, cotton shirt, under the brace. These are selected apply I'm teaching you. What else would they ask you? Those are the key. They can do anything. They can do sports. There's no restriction with sports. That's what they're going to ask you. After surgery, what do? You got to check neurovascular check. You got to do log roll, but it takes a while before these patients go to surgery. Most of the time, the brace can help with that, but the duration of the brace and wearing a cotton under the shirt is very, very important. Under the brace is very, very important. Now, last minute NCLEX tips. Last minute. If you see a drooling kid with a distressed airway, it's always going to be what? Epiglottitis. What is your priority? Airway. That's all we talk about. If you see a Carangelis stool, this is the buzzwords I've been talking about. What are we talking about? Intussusception. And what are we going to do? Air enema. And what are we looking for? Brown stool after that. If we see Carangelis stool, we have a problem. If you see a kid with the cyanosis who have tetralogy of Foley, what do you let them do? They have in Tet Spells. What do? Need to chest position as much as possible. If there's a projectile vomiting and the kid is hungry after feeding, Pyloric Stenosis, buzzwords. And what? If you have edema and proteinuria, it's Nephrotic Syndrome. What do you worry about? Infection. Adapting class, pediatric crash course. Watch this video. Go take a pediatric test and let me know how you do. Thank you for watching. If you like this video, put a little bit of comment down. And if you need more, subscribe to Adapting Class for content like that. Take care of yourself and good luck.